All right, so first, just to start off with some good, some highlights, good news. Our epilepsy center, those of you that know our epilepsy monitoring unit and that work know that that is a top of the line, sophisticated unit that does, diagnostic and treatment of people with complex seizure disorders. And it just received accreditation as a level 4 epilepsy center, which is the highest level for that work. We just got this year again the Heart Failure Gold Plus Quality Achievement Award. That's from the American Heart Association for our work around heart failure. And what that means is that people that come in with heart failure, they're getting the right care, they're getting it consistently, and that's what that measures or recognizes. For the 4th year in a row, we were recognized as most wired hospital. That speaks to our level of IT sophistication and integration in our practice in the hospital. And although it hasn't been announced yet, and we'll have to embargo this video, we are set to get a very prestigious HIMSS, which is the Health Information Management Systems Award for some of our IT work. So that should be coming sometime soon, but that'll be a very significant announcement as well, recognizing that really the great work of how sophisticated our systems are in terms of the electronic health record and how we use that data to improve our care. And then our Parkland Academy just received a $178,000 grant from the Dallas Women's Foundation to support our Rise to Success program. The Women's Foundation loves that program. I saw them last night, and they were talking about this. You remember, for those of you that don't know, that's our program where we work with high school students to help them get integrated or acclimated to a career in healthcare, healthcare-related work, and we bring them on, teach them, and then support them through education so they can advance in their work. It's a great program, and Dallas Women's Foundation and others have recognized that. And so I'll tell you this too while we're on that topic. When I look at our work here, we kind of have 2 big branches of work. The obvious one that we all know and think about every day is how we take care of patients, right? We want to make sure we're doing a great job of that, providing good quality and good experience for patients and families. But there's another big branch that we focus on and want to focus on, that is how we take care of our employees. And are we providing opportunities for people to advance? Are we providing opportunities for education? And this is, I think, a great example of that, because we've got programs all the way from GED to master's program that we will support our workers, our employees with. And I know, and I've heard in some of the conversations asking people how those programs work, some of the things that issues raised are, do we both provide educational opportunities and then provide opportunities for advancement once people take advantage of those education programs, and how good are we at lining those things up? I think we've got some work to do in those areas that we're aware of and focusing on. I may talk a little bit about it when we talk about succession planning too. But anyway, some good news and programs to recognize. Let's see, I passed one, sorry. A quick update on our strategic plan. Remember, this year we have 3 common goals for everybody in the system. These count 20% to everybody's performance appraisal, same goals, one related to patient satisfaction, one related to our budget, and one related to patient safety events around 2 patient identifiers. So on the Press Ganey patient satisfaction, we set a goal to move from 85.2 to 85.9. Doesn't sound like a lot, right? But as these numbers are higher, the opportunity for improvement is compressed. So that's a statistically significant. That would be a meaningful increase for us. You can see we're at 85.77, just below that. So we may fall just short of that one this year, but we're close. On the budget, we are doing well on the budget this year. We certainly expect to hit this mark this year. This will get reported out at our Budget and Finance Committee of the board in 2 weeks, and we expect that we're going to definitely hit our budget mark. And then on the patient safety events related to 2 patient identifiers, remember, that's all about making sure that the care we provide to patients is actually provided to the right patient. And while that seems very obvious, when you've got millions of transactions that happen in the hospital over the course of a year, there are opportunities. People have names that sound similar to each other. When I go out in the waiting room and say, Linda Wilkerson, and you think I said Mercy, then you come forward instead, Linda, and so it's easy to make mistakes sometimes. And so every patient interaction, we want to say, can you tell me your name? Can you tell me your date of birth? So that we don't have any of those miscues. So for that score, we're at 682, slightly above the target as well. And so we will keep these goals or similar goals to this on for the coming year. And I'll talk to you a little bit more about what we have planned for that in a few minutes. But remember these three: one around patient satisfaction, one around budget, and one around two-patient identifier. We are in the 5th year of our 5-year corporate integrity agreement. So it starts end of May is kind of the start time for that. So we're well into the 5th year. End of May in 18 will be the end of 5 years. We expect after that time to have several months of reporting and various things like that. But we expect to do everything we need to do to comply with that agreement so we can graduate from the CIA next year. That's obviously a big deal for us. But one of the things that we need to remember and we focus on, and our QRO, the quality review organization that provides a lot of on-site oversight for us, emphasizes is when that time comes, it's not as if we just quit doing everything we did during the past 5 years to make us successful here, but that we all need to have a good sense that that activity, that work's going to continue. And so when the QRO looked at their areas of emphasis for this year, for year 5, at the top of the list was incorporating the quality review organization functions into our operations. How do we make sure, kind of going forward, we're still doing all the monitoring around safety, around quality, around compliance that we're getting from an outside set of eyes. And so one example of that, just last week, we had a mock survey. So that was a group that we hired to come in, act like the Joint Commission. They spent a week, 5, 6, 7 people at a time, to look to see how are we doing against our standards. And I'll mention a few things about that in a minute. But that was at the top of the list. And so we've got a lot of activity around making sure those functions of the QRO continue. One of their points was around integrating inpatient and outpatient operations. We do that quite a bit already, but we know we have gaps. Sometimes information on the outpatient side doesn't translate to every encounter on the inpatient side. Sometimes a piece of clinical information might not get followed up. How do we ensure that things don't fall through the gaps at different points in the system? And so we'll have a renewed emphasis on that this year. Succession planning so that if someone leaves the organization, we don't experience a gap and sort of slide back in the knowledge, particularly around these quality and safety and compliance issues. And then more general around HR and some improvements in the support functions of HR. Specifically identified was around total rewards, which is our how we do compensation and benefits, but also general support. And so you should be hearing a conversation around that. We've got a group on site called Mercer, which is a consulting group that the QRO suggested that we bring on to help us look at this. And so some of you will be getting surveys from them to ask you what your support from HR is like, where we can identify gaps that we need to address. So, any questions about that? That's not all of our QRO, our CIA work, but those are the areas of focus for this year. All right. What's that? Can you move it for me? Thank you. Okay. quality and safety, and what's active in this space right now. I mentioned our mock survey. We do that because, one, we just want to make sure that we're always in survey mode. Our window for Joint Commission is now. They could show up anytime between, well, March of 17, which is past, and up to September of 18. What typically happens is they come closer to the end point, closer to September 18. But we're in the window, and that survey could happen anytime now. So we are looking at what trends, what Joint Commission is focusing on these days. So reading the literature, seeing what they're doing with other organizations. I'll tell you this, in the mock survey group emphasized this with us as well. It's getting tougher now with Joint Commission. And I think some of that is driven by the fact that there might be a high-profile event at a hospital that CMS gets called in to look at, and they were just recently surveyed by Joint Commission, and that didn't show up on their survey. And so Joint Commission is feeling a need to be more thorough, to be more precise, and so some of that pressure is going to translate into how what their surveys look like. And so they are getting tougher. Whereas in the past, if they saw something minor, they might note it, but then move on. Now, if they see something, it's going to be something that's referenced in their findings. And so we're looking at what Joint Commission is focusing on. Some of the things, particularly around behavioral health. So the ligature risk, basically that means where in the hospital where we're seeing people with behavioral health problems, where they might have a hook or an edge or something that they could tie something and hang themselves with. So they are looking not only in your psych area, but in other parts of the hospital where psychiatric patients may go. And so we've already done some work in the 17th floor, looking at that, but also in other parts of the hospital, particularly around the ED, to make sure we're not exposed there. Issues around medication management is always something that Joint Commission is going to be looking at. Consents, storage of needles and syringes. This came up in the mock survey in the anesthesia area. Some people walking with syringes, medicines in their pocket. We've got to make sure that we're following the rules on sort of how we control access and use of medications. And you can see other ones, linens, life safety, sterilized instrument. That was something that we had issues with last time, what we did with dirty trays. And people in these areas are going to be made aware of this. So if you're saying, well, that's not my area, there's targeted activity going on in each of these areas. Also importantly, two-patient identification. That continues to be an issue for us just because it's so prevalent in terms of the opportunities for errors. Right? So it's not just at the bedside in the clinic, but if it's in registration, if it's in the lab, when you look at where those problems occur, it's mislabeling, it's, and those things where we may catch it be an inconvenience to a patient, they have to get blood redrawn, all the way to, you do the wrong procedure on the wrong patient. And so you can see the opportunities can range from kind of very minor to a serious consequence. And so we always want to remember, do two-patient identifier at every encounter. Can you tell me your name? What's your date of birth? Does that match who you think you're supposed to be seeing at that point in time? Most events are in registration and labs. And if something doesn't look right, if it doesn't feel right, this is not only true for two-patient identifier, but for the entire quality program. We have to be comfortable saying, hold on, stop, and escalate the concern. Bring that to the provider, to the manager, whoever you need to escalate that to pause and make sure we're making the right decisions. I remember Dr. Fuad Khan had a saying in the Psych ED, when they would discharge somebody, they would have a huddle before somebody was discharged. And Dr. Khan's phrase was, the nervous wins. If somebody was nervous about that discharge, then they didn't discharge. They'd go back and take a step back and look and consider, okay, what is causing you to be nervous about that? Obviously, in that area, it can be tricky at at discharge, so you didn't want to make that mistake. And so I thought that was a great phrase, the nervous wins. But it goes for every part of the hospital, wherever we work. And if there's a concern, if you think we're missing something, it's best to pause, stop, check before moving ahead. So that's our quality and things we're focusing on there. I talked to you about the mock survey. That group was on site last week. The general sense from the group, which was great to hear, and I tell you, you hear this consistently. When people come and look at our work, they're always impressed by the people here, by the staff, by the way people live the mission. You know, the people that work here are bound to that mission, and it comes across not only with the surveyors, but when they watch you care for patients. And so they were very positive about that, and they talked to patients, and the patients were extremely positive about that. So that's the best news I think we could get, is that you know, we, our employees in those observations are seen to be living our values. You know, are we compassionate? Are we respectful? Are we doing the things that we say we want to be as an organization in the way that we take care of patients and their families? And the surveyors saw that in the staff, and they heard that from the patients. Now, we pay them to come in and find problems, you know, things that we need to work on, and they absolutely did that. And so these are some of the areas that they identified for improvement. We will have action plans that go, we'll get a formal report from them in a couple of weeks, and we'll have action plans to address all of these things. Something we know that's been an issue for a while, fire safety plans, like, you know, when you have a fire in your area, what's the response? Everybody should have a pathways on this, right? Does that sound familiar to people? So do your pathways, pay attention to it, understand it. When the surveyors come, you could just be walking in the hospital, and they're going to stop you and say, okay, what happens when there's a fire in this area? And you have to know the difference between, you know, if you're in the hospital building where we stay put behind firewalls, and if you're in one of the clinic buildings where people are expected to leave the building. And there's some other details that are in that pathways module, obviously, but do your module, pay attention to it, and if there's questions, again, then we need to raise those questions so that if you're in an area and you're not sure where, you know, where your pull stations are, what you do when there's a fire alarm, we need to make sure that you raise those concerns so that people are comfortable there. I talked about sterilization and tray management. They had some opportunities around our procedural areas for that, medication management, things like when you use the tube system for medicines, who's on the receiving end? How do we know that it's secure? That all the way to, you know, I mentioned in anesthesia, people having syringes in their pocket, having in and out of the medicine boxes. So there's some work that we have to do there to be more consistent with how we're managing medications. And then they identified some areas around patient safety goals. Again, procedural areas, things like consistent timeouts, who's present for the timeouts, and other things around that. Next week is National Quality Week. And so if you go on the intranet, you'll see a list of activities. There'll be a lot of stuff going on to just, again, raise attention to the issue of quality and how we're approaching that here. It's core to our work, right? I mean, it should be embedded in everything we do. And so this week will be a chance to kind of highlight that. We'll bring in speakers. We'll have people from inside the organization. We'll bring in some outside perspectives. There'll be games. There's a nursing summit that's a nursing fair that's associated with it as well. But you can go onto the intranet and look and see of all the stuff that's going on, and hope you'll take advantage of participating in some of that. In that line, there is also a culture of safety survey that we do every year. This is AHRQ is the Agency for Healthcare Research and Quality, and they do nationwide. They will do a culture of safety survey for health systems, and this helps to identify how we understand and approach quality and safety. What do I mean by that? Well, do we feel comfortable raising concerns? Do we feel comfortable identifying near misses, reporting those things? We report a lot here, and that's the only way we understand if there are issues for us to pay attention to, right? So if we didn't report, we wouldn't know if there's a trend or with a particular behavior or a particular problem. And so this survey is intended to get a feel for how the entire organization understands, appreciates, feels about our activity around quality and safety. So that survey will be in the field next week. Please, when you get it, look for it in your email, and when you get it, take a few moments to answer it, please. It's totally anonymous. It's not. We don't track that email, so we're just looking for the sense of the organization. Get your flu shots. Everybody should have that information. Open enrollment ends tomorrow. So if you haven't done your open enrollment, if you're going to buy or sell PTO, if you're going to do something with your flexible spending account, you have to renew that every year. So go into the website, and it's pretty easy. It's self-explanatory to track, but you got to go in and do it. So it's on
the benefits section.
Got that? PeopleSoft benefits. Yes, ma'am. Pet insurance. I thought we might have.
I don't think pet insurance was actually on the list of benefits you could sign up for, but they had it in the benefits fair, and you could pick up that information and call about it, I believe. Yeah. But if you go to the OTM portal and ask that question, they'll be able to answer it for you.
Okay. In terms of spousal coverage, we did this last year, I believe, and we'll continue to do that. And that is, if you have a spouse that is eligible for insurance through their employer, then if they want to be on Parkland's coverage, there's a surcharge associated with that. If you have a spouse who's not eligible for coverage, then there's no surcharge for that. And the reason for that is just most other organizations are doing this as well, and if everybody else is doing it and we're not, then we're going to pick up all the spouses on Parkland's plan. That's going to be an added expense for us. And so what we're trying to encourage is if your spouse is eligible for coverage through his or her employer, then we would like them to take advantage of that, so all of those costs don't fall to Parkland. In terms of the retirement income, I'll start off with saying our retirement plan is healthy. You might read in the paper about the Dallas Fire and Police and the sort of the difficulties of those plans. There was a lot going on during the legislative session around that. Our plan is very healthy. We want it to stay healthy so that everybody, when you retire after, we had a 45-year person the other day at our celebration of years of service. So when you retire after 45 years, that all your benefits are going to be there. It's a defined benefit plan, so we want to make sure that those benefits are there when you retire. So we have increased this year the employee contribution from 5.5% to 6.2%, so a 0.7% increase. That 6.2 lines us up with Social Security. Remember, if you're participating in Parkland's plan, we don't do Social Security. We do this instead of Social Security. The long-term benefits for our plan are better benefits than you would get under Social Security, but the employee contribution has been lower, and so we are now aligning, and hopefully we intend to stay at that point, aligned with Social Security. Now, it's still a bit of an uptick, and so what we wanted to do this year, we wanted to kind of invest more in the plan so that the plan stayed healthy for the long term. But we also wanted to try to do something more for employees at the same time. And so coupled with that, and hopefully we'll be able to continue to do this, we are implementing this year, and we thought about doing this last year. We just didn't have the budget room to do it, but this year we budgeted it. It stayed in the budget, and that is a 2% increase above the merit. So you'll still be eligible for the traditional merit increases that we get every year. But on top of that, in fiscal 18, we'll have a 2% incentive pay, and that is going to be tied to those three goals that I showed you earlier. And the idea there, I'll tell you, is a lot of healthcare organizations, a lot of companies, there's a philosophy that says, if you want to drive performance, you've got to reward that with incentive pay. and Parkland used to have one of those programs for the senior executives. We haven't done that for the past few years because, quite frankly, I think that's a harder program for a public hospital like Parkland. It's a tougher thing to pull off, and I'm not sure our people are as motivated to perform by 10, 15, 20, 25% incentive bonus or incentive for executives. And so we haven't funded that in the past several years, but there has still been a desire, and we've had some discussions at the board level about an incentive program. And so what we propose for this year, and was accepted, and we've got it in the budget, is instead of doing something for the VPs and up, that we did something broad-based. So it'll be much smaller in terms of percentage, obviously, because you can't get to high percentages when you're doing 11,000 people, but it would still be meaningful. And so we budgeted a 2% incentive pay, and that would be distributed at the end of the year. And so those three goals I showed you earlier, there'll be one around patient satisfaction, for practical purposes, because we want something that all areas measure. The measurement's going to be patient's likelihood to recommend, and that's something they get asked consistently across inpatient, outpatient settings. So likelihood to recommend, significant improvement in that metric, making budget, and having a reduction in in errors involving two patient identifiers that reach the patient. And so it's not the very low level, the wrong person came back from the waiting room, but it's an error that actually reaches the patient. And so those will be the three, and we'll publish these shortly, but those will be the three goals. And if we hit those, if we hit the targets there, and we'll try to build in some, we almost hit it, and so you get partial credit in there, because we want them to be meaningful, but we also want to be able to do a payout too for that. And so that 2% will be calculated on your base salary and will be done as a lump sum at the end of the fiscal year. So hopefully between October and before the end of the year, but it depends on how quickly we can get the results tabulated and scored. And I think that's it. So yes, questions?
Well, I have two.
Okay.
One, who's going to be eligible for the 2%? What people, from what level down?
Everybody.
Oh, perfect. And then the second question I have, because it's a concern.
Can I, so on that, so you might say, okay, why, how do you get something that's meaningful to everybody? But if we have a patient satisfaction score, likelihood to recommend, that could be, you could influence, if you're a non-clinical person, I'm in IT, I'm walking in the hospital and you see a family that's lost, and taking care of that person and family, you'll have an impact there, you know what I mean? If you're in environmental services, you have an opportunity to interface with patients, whether that's in the cleaning rooms or whether that's getting the rooms clean so somebody can move from the ED quicker, you know what I mean? So even though it might seem like, well, that's just that's a clinical measure, it's really not. It applies to everybody. And we wanted something that we could spread across the organization so everybody could participate. So everybody's kind of pulling in the same direction on those. So anyway, what was your second question?
I agree with what you said. It's having a big issue for everybody. The second question is, it's something that it does bother me a great deal in terms of, because I love Parkland, but I'm also an older person, should I say, and so I'm concerned about our debt.
About.
Our debt.
Uh-huh.
I don't like having debt, and I want to know how we're going to address our debt.
You know what I didn't? I flipped through. I think I flipped through the property slide.
We had like $59 million before. I mean, to me, that's a lot of money. It may not be a lot of money in terms of an organization,
Uh-huh.
but I want to know, where are we at on our debt and how are we going to get our debt down?
Yeah. So
I have people that will not come. I have nurses that would love to work for Parkland, but they won't do it. And they're in my age group, and because they're concerned of debt.
Yeah, it's interesting. It's because if you look at our debt structure, we just got our bond rating, and our bond rating is stable. We're AA. We have a good bond rating, and it's a stable bond rating. And so we certainly have debt on this facility, but that's that's very typical for the industry. It's the way, other than us squirreling away $1.3 billion and then building a building without debt. It's the only way you kind of keep up and with your major capital needs. So we do have debt on this, but we have a good bond rating, which takes into account how much debt you have. We have a bond, we have a tax that covers our debt every year. And so, this year our tax revenue went up 7.5%. And so we have good county support. We have good support from our local tax base. And that covers about a third of our budget, actually. And then, our patient operations covers the balance of that. But so from a hospital system perspective, we're in good shape there. Our pension plan is in good shape there. And so, and like I said, and that's kind of confirmed with our bond rating that we just got. That was a stable bond rating. So I haven't really heard that concern. But I'm like you. I don't like debt either. But from a business perspective, it makes sense that you go into debt to build this, and then through your operations you account for that. And so we're certainly not an outlier in that regard. Okay. I will tell you about because it's related. I skipped over this by accident, and people generally want to know what's going on with the facility. We are now under contract to sell the old stuff on the other side of the street. Doesn't mean it's completed, it's a done deal, but we are under contract with a buyer. That contract has to be presented to our board, then it has to be presented to the Commissioner's Court, and then the buyer has to complete what's called a due diligence period, where he can change his mind between now and the end of the year. Although he's got $1 million down payment that he would lose if he just changed his mind. So he's serious about the deal. So we will be, over the next month or so, bringing that contract to our board, to the Commissioner's Court for approval, and then moving to a purchase sale agreement early in next year. That will involve us, over the 3 years after that, moving the activity in that space over to this side of the campus or somewhere else. So what will be in the deal is an agreement to lease back space. So if we sell, let's say in February, then we will lease back the space we're in for up to 3 years to give us time to build what we need to build on this side of the campus. We'll have to build a parking deck over here. We'll have to build some clinic space over here. And we'll have to either build or lease some administrative space to make sure all the functions across the street have a place to go. And we'll have enough time to be able to affect that move. On the other side of the street, what the buyer intends to do is invest about $350 million in that site to make it a very nice place that's got hotel, apartment, condo with restaurant, retail, and so that space will be transformed, and it'll be nice. It'll be really well done. So it's not a finalized deal, but it's getting awful close to that. And so we'll sell for $82 million. We'll take those dollars, to your debt question, and use that to build over on this side of the street. Yeah, Kim?
So will they tear that down, or they will remodel to accomplish that?
They're going to keep the old hospital building in G&H. They're going to work in that space. I think like Building B, the Amelia Court stuff, they'll tear down, but the main buildings they're going to keep. Yep.
Will we maintain the bridge access?
Yeah, good question. Good question. So the bridge will continue its connections. It's connecting us to UT over there, to Children's that way. So that's part of the understanding, is that there'll be a continued connection there. Anything else? Yes.
This year's performance goals are tied to the system goals, the three, and it constitutes includes 20%, but how is that divided into these three goals?
Make sure I understand the question. So for this year, it should be common for everyone's in your performance goals that 20%. So if everybody's going to score the same, I think it's it's not a winner or a loser for any individual because we're all scored the same thing for that. Basically, what we wanted to do was kind of get started on, can we develop some system-wide goals that we could use? Could we score them? Can we make it work? With the anticipation, I was hoping that we'd be able to budget some incentive pay for it in the coming year. So this year, everybody should see the same impact on your scores because everybody's going to it'll be commonly scored. Is that your question?
Yeah.
Okay.
Percy, did you also want to know whether there was like 10%, 40%, 60%? I can find that out. I don't know how they weighted those.
How do they make up 20%?
Right.
Yeah, I don't know the
Whether
answer to that.
Whether they're evenly weighted or not, I don't know, but I can find out.
You had a question?
So I'm not sure this relates, but we've had a couple of attacks out in the parking areas. Do you know what they're going to do to make us feel safer?
Yeah, we just had this discussion last week at our chiefs meeting about parking. And we've asked for a plan. We're working with police on a plan that may include some additional monitoring and then on-site presence. But it's something that we've requested a plan that we want to look at and evaluate to see how we can make that big space safer. So, yeah. Yep.
So I had a question about safety. So one day I was walking over the bridge and I was going to the PR garage, and there were, you know how the inmates, the ones that can walk freely, they were over there on the third floor by the elevator that we would go down to go to the parking. And it's kind of uneasy, and it was like maybe 6 o'clock, 5, 6 o'clock, around that time when I went down there, and nobody's there. You're just kind of like, well, what are you doing here? You know what I'm saying? It was a very uneasy, so now I don't even go that route.
So first off, they shouldn't. If they're inmates, that's a problem. It's those the things that guys that have probation or something on them.
Probably, they're the orange stripe ones. Yeah.
What's that? We've done some work, and I thought, and we had made some progress on identifying. I think we were sending a homes van or something. There's a program that is people on probation that we'll send over to our urgent care center for services. And working with our outpatient group, we had identified a way to bring services to them. And I didn't see that group for a while, and now I'm seeing them back again. So, and you telling me, and it has to be, I guess it's got to be the same thing, because it couldn't have been an inmate.
No, they weren't in shackles or chains.
Yeah.
Because I deal with those, where I'm at, but it was still just that ideal.
Yeah, we'll take another look at what's happened with that agreement and why, that group is back on campus. But they're not, they're not under arrest. They're in a supervised program where they can go freely.
I mean, they didn't bother me. They were
Yeah.
super chatting, but it was still just that uneasy feel.
Right. And everybody, listen, I know you're not going to do it every time, but maybe some will. You can always call the police. If you're parked far and it's dark, you can stop by and you can get an escort to your car, and that's in sort of a kind of a stopgap, short term, one-off thing. You can always get that, and I hope people feel comfortable with that. But we are looking for a plan to have a stronger presence out there. Anything else? Okay. Lauren, anything to add? Sydney, got anything for us? No. Okay. I caught you off guard, sorry. Yep.
As far as parking plan, what property do we have, are we planning some, okay, paper area, or as far as the parking plan?
Yeah.
What's the parking plan?
So,
design gonna be for this site?
yeah, we had a group come in and look at this side of the street to see where you could would put the next buildings. And mainly to see, before we put something, is it gonna, would it get in the way of something we're gonna need 10 years later? And so they have a 40-year plan that would have multiple garages and multiple clinics, so we can put a lot on here. We're trying to acquire the church property too, and I think we're pretty close. We're going to Commissioner's Court next week to try to get approval for that. We have a contract on that property. We have to get Commissioner's Court approval on that. That'll give us some more space. Y'all know on Medical District, the piece of property there. But the first garage would go back over there by the utility plant. That's the site. Am I getting that right?
Yeah, at the corner of
Yeah.
Texoak and Butler. Seems like the prime spot. In fact, it's where the Access Medical is right now, where that building is. That seems to be the largest site that we can put a, two, I'm sorry,
Right behind the logistics bid.
that's correct, yeah.
And would it
On
be
the other
employee
side.
parking only, or is this public parking?
Right now, we're just looking at staff.
Yeah, I know, what we have to replace is ER Garage and Motor Street, so. I can't tell you definitively how that'll sort out, but that's the part, that's what we gotta move, so. Okay? All right, guys, thank you.